Section 4 Styles of Teaching. There can be no single way to study or best way to teach. Knoll and Twistle, Styles of Learning and Teaching, 1981. Choose the most appropriate method from the rich menu of learning opportunities available and use it to maximum effect. Lectures can make a valuable contribution to the education program. Careful consideration needs to be given to the reason for their use and how they are delivered. A flipped classroom may be useful. Small group teaching has a part to play if used appropriately. The teacher's role is different from their role in a lecture. Students and trainees should be given more responsibility for their own learning. The learner may require support and direction. Lack of planning and poor supervision coupled with inadequate feedback to students often blights clinical teaching. Simulated patients, mannequins, models, and computer simulations complement experience with real patients and have a place in a training program. The internet and resources available online have revolutionized medical education. They can make a significant contribution to the education program. Students learning from each other is effective. This can be informal or incorporated into scheduled activities. Chapter 23, the lecture and teaching with large groups. Lectures can make a valuable contribution to the education program. Careful consideration needs to be given to the reasons for their use and how they are delivered. The use of lectures. Of all the approaches to teaching, the lecture is perhaps the method most widely adopted. It is estimated that the average medical student sits through some 18 lectures in the course of their studies. Most will be quickly forgotten, a few may be memorable. Despite much criticism, the lecture has stood the test of time. It has a lot to offer and it should not be tossed aside as being ineffective and as a result excluded from the teacher's toolkit as described in Chapter 13. Brown and Manaugh describe lectures as an economical and efficient method of conveying information to large groups of students. The lecture can provide an entree into a difficult topic. It can offer different perspectives on a subject. It can communicate relevant personal, clinical, or laboratory experience, and it can deliver a research-based view where teaching is immersed in a research-intensive university. The way lectures are being used, however, is changing with greater engagement of students during the lecture and recordings of lectures being made available to students. In the flipped classroom model, there is a fundamental change in the nature of the use made of the time previously allocated to a formal lecture. Problems with lectures. Problems attributed to the lecture may be the result of a bad lecturer or the inappropriate use of the lecture. Common criticisms of lectures include the lecture is a passive learning experience with a failure to engage students in their own learning. Much of what is covered can be learned better from reading a book or engaging in an online program. The lecture is badly presented and difficult to follow, with the visuals overloaded with information. The content of the lecture is inappropriate for the audience and is irrelevant, too advanced, or too simple. Figure 23.1, the lecture has been much criticized. When to use lectures. Lectures, if used properly, offer a number of advantages. The lecturer can meet simultaneously with a large group of students and convey his or her passion and enthusiasm for a subject. The lecture can serve as an introduction to a difficult topic and provide the students with a framework for their further studies. Dealing with a controversial area, the lecture can provide different perspectives and at the same time relate the topic to the local context. In an advancing area of knowledge, the lecture can provide up-to-date information and highlight the contributions of research in an area. The lecture can be used to provoke thought and discussion and to encourage the student to reflect on the topic. The lecture can include a practical demonstration, for example with a cardiac simulator or a patient introduced to illustrate a point. The lecture can provide the students with guidelines about their further study of the topic and can introduce the resources and other learning opportunities available. Delivering a good lecture. Lecturing can be a daunting task for some teachers who feel ill at ease when asked to perform in front of a large audience of students. Much of the stress can be alleviated with good planning and preparation. Get some facts in advance. Before concentrating on the content of the lecture, first do some fact finding. Study the learning outcomes for the course. Based on these, consider how the lecture fits into the curriculum. Find out what the students already know about the subject of the lecture. Establish whether the lecture is one of a series of lectures on the subject, and if so, what the other lectures cover. Find out about the venue and the equipment to be used. Think about the content and structure. Plan in advance the content and structure of the lecture. Plan the content for a lecture the students will wish to hear rather than the lecture you would like to give. Create a title for the lecture. It is sometimes easier to get started with the content if you first think of a title, as it helps to structure your thoughts. It is more likely to interest students if the title is in the form of a question. Consider how you wish to structure the lecture. Two commonly used approaches are the classical method, where the lecture content is divided up into broad areas which are then subdivided, and the problem-centered approach, where problem or case study is presented and solutions are discussed. This chapter focuses on the classical approach, although most of the tips given apply to both approaches. Lecturing styles vary considerably, so you must choose the style you feel most comfortable with and which suits your personality. The introduction to the lecture. It is worth spending some time preparing your introduction. The first few minutes of the lecture are the most valuable. Try to instantly capture the attention of the audience and highlight why the content of the lecture is important. An engaging start to a lecture might include a press cutting of a case where error has been made in the management of a patient. It could be an illustration of a patient where an understanding of the pathophysiology proved valuable in the patient's management. You might use an interesting statistic highlighting the importance of the topic. Robert Cialdini is quoted as saying at the beginning of a lecture, "Here's a set of events unexplainable by common sense, and I promise you'll be able to solve this mystery at the end of the class." Don't keep the student in the dark about the content of the lecture. Tell the student what you are going to tell them, then tell them and finally tell them what you have told them. Advanced organizers can help. These are signposts that help to guide the student through the content as you have structured it. For example, we will look in Channel 6 features of, or first we will look at, then at, and finally at visual aids. Visual aids help to reinforce and emphasize important points in a lecture and to explain difficult concepts or principles. They also help to vary the pace of the lecture and to maintain the student's interest. Video clips can be used to introduce case studies. Check for typographical errors on text visuals, as spelling mistakes damage your credibility. Also, make sure that students at the back of the lecture theater will be able to read the text or captions on your visuals. It is amazing how many teachers fail to do this. PowerPoint is an application designed to help the speaker or lecturer assemble professional-looking slides and is widely used in oral presentations. The result, sadly, is often an unending stream of slides with word lists, animations that obscure rather than clarify the point, and cartoons that distract from rather than convey the message. A host of sites are available on the web that provide practical advice on PowerPoint presentations and can help you to avoid death by PowerPoint. Visual aids are a tool to help the teacher get a message across to students in the most effective way. The lecturer, not the PowerPoint slides, should be the star of the occasion. The text on slides should complement what is being said, not replace it. Engaging the audience. There are a number of strategies that can be adopted to transform your presentation from a passive to an engaging and active experience for the student. These include introduce questions on the subject at various stages during the lecture with a number of alternative answers presented. Students are asked to respond using an electronic response system, or colored cards can be used with a different color corresponding to each answer. Electronic response systems use either devices or clickers which allow each student to respond to multiple choice questions, usually incorporated into a PowerPoint presentation or an app which enables students to respond by web, text, and Twitter. Students go to a URL and questions are posted to that URL. A range of products are available in both categories. Incorporate mini brainstorming sessions during the lecture where groups of 3, 4, or 5 students next to each other are encouraged to discuss a topic. Some groups are asked to report back to the whole class. Alternatively, the groups may answer and respond to a multiple choice question using cards or an audience response system. This is a free activity in turn-based learning. Introduce or build your presentation around a case study or patient management problem, involving the class as the problem develops. The close of the lecture, the end of the lecture, is almost as important as the introduction. Summarize the main concepts or messages you wish to convey and prepare the students for any further lectures that may follow in the series. Try also to leave students with something to think about following the lecture, which may stimulate a discussion with their colleagues. Handouts, a printed or digital summary of the lecture can provide the student with the framework and also the essential messages you wish to convey. It can be designed in such a way that students are encouraged to personalize it with their own notes as the lecture proceeds. Handouts may be valuable for revision purposes. Some lecturers use copies of their PowerPoint presentation as handouts, but this is less satisfactory than handouts designed specifically for the purpose. If you want to encourage students to take notes during the lecture, make sure that you leave sufficient time for this activity. Students' presence and behavior at lectures. There has been an increasing trend for medical schools to video lectures and to make them available to students as podcasts. The advantages are obvious. Students can choose when they wish to listen to them and can pace themselves. We have found that students can vary by a factor of 4 in the amount of time they spend listening to the same lecture. On the other hand, concern has been expressed that if podcasts are available, students may not attend the live lecture and miss the level of engagement and connection with the teacher that can be a feature of it. Recordings of lectures might be better replaced by a carefully designed instructional program developed to meet a student's needs, but this is more difficult and expensive to prepare. In the case of the live lecture, another issue that has been debated is whether students should be allowed to engage with their computers and with electronic devices during the lecture. While such devices may be used to enrich the experience, the student may be distracted by texting, emails, and playing video games. On both this issue and the recording of lectures, opinion is divided. The flipped classroom. What is a flipped classroom? A significant development in recent years has been the concept of a flipped classroom. Scarcely a conference on medical education goes past without this being on the agenda. The term was first used in 2007 by chemistry teachers Jonathan Birdman and Aaron Sams. They argued that students need to have their teachers present so that they can answer questions or provide help if there are aspects of a topic where difficulty arises. However, students do not need their teachers present in order to listen to a lecture or to review content. They proposed that in the flipped classroom, students watch recorded lectures for homework and then engage in further work and discussions in class with their teacher. Figure 23.2, a comparison of the traditional lecture and the flipped classroom. The traditional approach. Students acquire facts in a lecture. Following a lecture, students work individually or in a group to explore the topic and apply the information learned to practice. The flipped classroom approach. Students work individually or in small groups and acquire the facts. In lecture settings, students explore the topic with the teacher. In Best Practices for Teaching with Emerging Technologies, Pacansky-Brock described the concept. The flipped classroom model uses video recordings of lectures that are shared with students before class time, freeing up face-to-face time to interact with students and apply the information learned in the videos. Ultimately, classroom time is transformed from a passive to an active experience, and the role of the instructor shifts from sage on the stage to guide on the side. Application in medical education. Experience has shown that the flipped classroom approach can be applied to medicine and may even be a building block for curricular reform. Advantages and disadvantages of the flipped classroom. The advantages of the flipped classroom outweigh the disadvantages. The advantages include: students take ownership of their learning. Learning is personalized to the needs of the individual student. Students can work at a pace and place to suit them according to their preferred learning style. Learning takes center stage and students get multiple opportunities in the large group sessions that follow the preparatory work to demonstrate their understanding of the topic. The focus is in understanding our topic and in the application of the principles to practical examples rather than simply an acquisition of information. Students receive important feedback and areas of difficulty can be identified with remediation provided as necessary. The approach provides teachers with the opportunity to engage with students and to get a greater buzz from their face-to-face teaching. The disadvantages include: students must be disciplined to study the topic using the resources recommended prior to attending the whole class sessions. The preparation of the learning resource material to an acceptable standard takes time, and some teachers may be concerned about criticisms from their peers when the material is made available. The program for the whole class session requires careful planning, and the teacher may feel uncomfortable with the level of uncertainty. Implementation in practice. It has been demonstrated that a major curriculum reform is not necessary to implement a flipped classroom. A teacher can implement a flipped classroom for one or more of their lectures. Careful thought and planning is necessary if the flipped classroom is to be a success. Time should be scheduled for students to study the resource materials prior to the large group session. The learning outcomes should be made explicit. Ideally, a choice of resources should be available to students. This could include recordings of the lecture, learning resources prepared for the purpose, and online texts. Before the classroom session, students can engage by writing notes, identifying a question or issue for consideration by the class later, and discussing the topic with their peers. Options during the classroom sessions include consideration of questions or issues raised by students, consideration of areas of difficulty, a review of learning outcomes, an in-depth discussion of selected topics or key issues, and application of the knowledge gained to new problems.